My name is Aaron Kowaleski. I'm an interventional radiologist. My education is a little bit varied. I went to undergrad at the College of William & Mary in Virginia, med school at the University of Arkansas, internal medicine in Birmingham, Alabama, then did my radiology residency at the University of Kansas, as well as my fellowship in vascular and interventional radiology. After I'd gone into private practice as an emergency physician, I left Birmingham and joined an ER group in Arkansas. Seeing the imaging in the ER, treating these patients, and then finding out where they were going, I'd never heard of it. So I started doing a lot more reading and finding out exactly what the field was, and I was fascinated. University of Kansas Vascular and Interventional Radiology Fellowship is the largest volume fellowship in the country. One thing I did learn in fellowship is that there was nothing that IR couldn't do, whether or not it was cancer, peripheral artery disease, vascular malformations, GI bleeds, trauma. We did everything, stroke, spinal fractures. Echo was a several-year project that had been in the back of my mind since training. I started kicking around the idea of developing an outpatient IR practice around about 2012 or 2013. I went to Richmond, Virginia, joined a larger diagnostic radiology group. There was an opportunity that I felt that I was missing out on to really develop a relationship with patients, get to know them, get to know their issue, and follow up with them after we treated them. So after many years of wanting to reestablish that connection with doctor and patient, IR and patient, my wife and I found Denver as a market that was underserved and did not have these sorts of clinics, did not have things like Echo as it is today. Couldn't be happier with the move on a personal level, and then from a professional level, it's been great to treat patients the way I've always wanted to treat them and develop these relationships that I've always wanted to have since I first got interested in medicine. So I have a strong passion for peripheral artery disease. That's residual from when I worked with the vascular surgery group in Florida. There's a big need for people that do what I do. It's a very prevalent disease that's underdiagnosed, and you do a great service to these people. It's also a large reason why people develop non-healing wounds, which is one of the leading causes of amputation. So anytime you can restore circulation to someone's leg, they get to keep that leg. That is an unbelievable feeling and such a good service to people that need it. I also really enjoy treating cancer patients, specifically liver cancer patients. Developed a few programs in Florida and Virginia for that. What a tremendous opportunity to get to be with these patients in such a difficult time and be able to make them laugh, but also be able to prolong their life. The most memorable patient I've had since we opened Echo was a patient that did have non-healing wounds in one of their legs. They had severe arterial disease, and he was 102 years old and a former physician. At the time, he and his family were debating on doing nothing just due to his age, but he was very active still. He was still walking on his own. We discussed how minimally invasive these procedures were, how easy the recovery was, and I just followed up with him 4 months after his treatment, and we're actually gonna be treating his other leg because he saw such a great result and was able to move around better without a walker and is now in physical therapy. So everyone deserves an opportunity regardless of the age, and these things that we do are so well tolerated that no one should be excluded from medical treatment that's appropriate for them.